Insulin is a critical element in treating type 1 and type 2 diabetes. In this video, you will learn about different types of insulin and how to administrate them. Please watch till the end so that you can avoid any undesired problems. Insulin Basics. Inside the pancreas, the hormone insulin is made in the beta cells. With each meal, beta cells release insulin to help the body use or store the sugar it gets from food. In type 1 diabetes, the pancreas no longer makes insulin. Patients need insulin shots to use sugar. In type 2 diabetes, body cells don't respond well to insulin. Patients need insulin shots if diabetes pills are not enough to control blood sugar. Characteristics of insulin. Insulin has 3 characteristics. Onset is the length of time before insulin reaches the bloodstream and lowers blood sugar. Peak time is the time during which insulin is at maximum strength. Duration is how long insulin continues to work. There are different types of insulin depending on how quickly they work, when they peak and how long they last. Insulin strength. The standard and most commonly used strength is U100, which means it has 100 units of insulin per milliliter of fluid. U500 insulin is available for patients who are extremely insulin resistant. U40 has generally been phased out, but you could still find it in some parts of the world. Types of insulin. There are 6 types of insulin available. 1. Rapid-acting insulin. Onset is about 15 minutes, peak time about 1 or 2 hours, and duration between 2 to 4 hours. This type includes insulin aspart, brand name Fiasp, Novolog. Insulin glulisine, brand name Apidra. Insulin lispro, brand name Admelog, Humalog, Lyumjev. 2. Regular or short-acting insulin. Onset is usually within 30 minutes, peak time anywhere from 2 to 3 hours, and duration approximately 3 to 6 hours. This type includes human regular, brand name Humulin R, Novolin R, Velocilin R. 3. Intermediate-acting insulin. Onset is generally about 2 to 4 hours, peak time 4 to 12 hours later, and duration about 12 to 18 hours. This type includes NPH, brand name Humulin N, Novolin N, Relion. 4. Long-acting insulin. Onset is several hours, and duration is up to 24 hours. This type includes Degludec, brand name Tresiba. Detamir, brand name Levemir. Glargine, brand name Basaglar, Lantus. 5. Ultra-long-acting. Onset is 6 hours, and duration about 36 hours or longer. This type includes Glargine U300 Tugio. 6. Inhaled insulin. Onset is within 12 to 15 minutes, peak time 30 minutes, and duration about 180 minutes. This type includes Technosphere insulin inhalation system, brand name Afrezza. Premixed insulin. It is mainly used by people whose diabetes has been stabilized on a combination, for example, a particular mixture of rapid-acting and long-acting insulin. Since you don't have to draw up insulin out of 2 bottles, it is convenient for people with poor eyesight or shaky hands. Insulin delivery. The syringe is the most common form of insulin delivery, but there are other options. Insulin pens. There are 2 types of insulin pens. One contains a cartridge of insulin. You can replace a new cartridge when completed. Another is pre-filled with insulin. You discard the pen at the end. You can use the dial on the pen to set the insulin dose. Insulin pens utilize single-use needles. Pump therapy. Insulin pumps deliver insulin 24 hours a day through a catheter placed under the skin. Site rotation. The speed of absorption is different when you inject insulin at different sites. The order from fastest to slowest is the abdomen, upper arms, thighs, and buttocks. It is better to inject insulin in the same general area. For example, use the abdomen for your before breakfast dose, and the leg for your before supper dose. However, repeated injections at the same spot will cause hard lumps under the skin. Try to move around the specific area. For example, use the upper left part of the abdomen for day 1, the upper right part for day 2, and so on. Insulin storage. In general, store unopened insulin in the refrigerator, but keep the in-use bottle at room temperature. Injecting cold insulin into the underskin tissue could be painful. Some other storage tips. Keep insulin away from extreme heat or cold. Don't store insulin in the freezer, direct sunlight, or the glove compartment of a car. Don't use any insulin beyond its expiration date. Examine the bottle closely to make sure the insulin looks normal before use. A quick reminder, this video is for information only. Please seek medical advice from appropriate healthcare professionals. If you like the video, give it a thumbs up and share it with your friends. Comment below to share your experience in using insulin. Please subscribe to our channel. Your support means everything to us.